One next disease is Xerophthalmia. Xero is dry, ophthalmia is eye. So this is seen in vitamin A deficiency where there is drying of the eye surface. Dry of eye surface. Okay. Here what has happened? See, the first is XN. XN is night blindness. XN is night blindness. X1A and X1B. 1A is conjunctival xerosis. Conjunctival xerosis, that is drying, and once the conjunctiva is dried, it leads to formation of a Bitot spot. Easy to remember, B Bitot, B here. Okay, Bitot spot. X2. X2 is when there is corneal drying. So there is corneal xerosis, corneal drying. X3A is your Keratomalacia. Keratomalacia. What is Malacia? Malacia is melting. What is kerato? Kerato is cornea. Cornea has started melting. X3B is again Keratomalacia. Here it is less than 1/3. Here it is more than 1/3 of surface. Okay, so third, you can remember third. This is how you can remember 1/3. Okay, once the cornea has melted, then it will lead to a corneal scar. Okay, corneal scar. XS, and finally we have XF, which is fundus changes, which is UA Mura spots. UA Mura spots. These are retinal pigment epithelial changes because pigment epithelium also has pigment. In xerophthalmia, because of vitamin A deficiency, there is loss of pigment. Okay. Similarly, we have drying of skin also, drying of eye also. So please remember, first the conjunctiva is drying, then Bitot spot is forming, then cornea is also drying, the cornea is melting less than 1/3, melting more than 1/3, scarring, and retinal changes in the pigment epithelium. This is how the Bitot spot looks like. See here, this is the Bitot spot. Okay, treatment is going to be a supplementation with vitamin A. If the child is less than 6 months, then supplementation is 50,000 international units. If the child is 6 months to 1 year, then it is 1 lakh international units. If child is more than 1 year, then it is 2 lakh international units. This is the oral dose at 0, 1, 14 days. If you are giving IM dose intramuscular is half of oral dose. This is the vitamin A therapy. Okay, with this we come to the end of conjunctiva. Please remember, conjunctivitis, bacterial and viral. Bacterial can be membranous, pseudomembranous. Viral, please remember, can lead to hemorrhagic viral and adenoviral. Okay, trachoma is a chronic conjunctivitis, that is A, B, B, A, C, D to K, which is there, and trachoma presents as sequelae. Okay, sequelae are trichiasis, entropion, tylosis. Complication is your corneal opacity because of interning, because of eyelashes rubbing on the cornea. So corneal opacity should be avoided by timely treating the sequelae. What is the treatment? Treatment is SAFE strategy, SAFE. It was given by WHO as a part of GET. GET was Global Elimination of Trachoma, but obviously it has not happened. Okay. Next is ophthalmia. Any newborn born with watery eyes in the first month of life is pathological. The causes can be chemical, can be bacterial, can be herpetic, can be chlamydial, can be gonococcal. Earlier, gonococcal was most common. Now, gonococcal has reduced because of good antibiotics. Now, the chlamydial is the most common cause. VKC, Wernicke conjunctivitis, is spring catarrh, seen in summer months, seen in young boys who are chronically rubbing. There is ropey discharge, there is giant papillae, there is surgerontoxon, there is Maxwell-Lyon sign, and because of rubbing leads to keratoconus, that has to be avoided. It is a type 1 hypersensitive response. Flectin is a type 4 hypersensitive response against the tubercular antigen, against the staphylococcal antigen. So it leads to a limbal nodule formation, which is there. Okay. Pterygium and Pingicula are elastotic degeneration. Pterygium patient will present with a cosmetic problem can lead to a astigmatism. In pterygium, there can be astigmatism which can be there. Okay. Xerophthalmia is xerophthalmia, that is drying of the eye due to vitamin A deficiency. Remember the classification and remember that the treatment is for vitamin A supplementation. In case of a corneal melting, you treat it as a corneal ulcer. Okay. Whatever therapy is required for corneal ulcer, that has to be given. Okay. This is what is Conjunctiva. Hope you are able to answer all the questions of Conjunctiva.